Hi, I'll quickly summarize 3 or 4 important points related to urinary tract infections in children. So, urinary tract infections are more common in girls than boys, and obviously that's because of the nature of the genitalia. So, the female genitals are in close proximity to the anus, and the urethra, which is the tube which goes from the bladder to the external, is very short. So any infection from the anal area or in the perineal area can get into the urinary tract if your hygiene measures are not good. The second point, boys are at equal risk of urinary infection in the first few months to a year, and urinary tract infection in boys at this age makes you wonder if there is any underlying urinary tract abnormality. The third point is the water intake is very important to reduce the risk of urinary infection. You can read my recent blog on fluid intake in first year of life or water intake in the first year of life. Adequate hydration is important as the child grows, as they start exercising. So in addition to hygiene, you also need to look at water intake. So in terms of hygiene, one important message that we should tell the parents of female babies especially is that the cleaning should always be from front to back. So never bring anything from the back, which is the anal area, to the front. And the same applies to washing the genital area. So before bedtime, it's a good habit to wash the genital area with water. Don't use soap, because repeated use of soap can cause dry skin, and the itching leads to scratching in that area, which can again introduce infection. So you can use a moisturizer if the child has itchy skin there. Again, you can review my video on worm infestation, because worms are one of the reasons why you get itchiness. Pinworms, for example, can cause itchiness in that perianal area because the worms come out at night and they start scratching. The point that I would like to stress to medical personnel is don't advise a bag urine sample for culture at any time, irrespective of the age. A bag sample can be used for a urine routine if the child is presenting with fever or with vague symptoms like poor appetite or poor weight gain. You can do a urinary routine. This will give you the cell count, the protein and the sugar in the urine, which will guide you to whether you're dealing with infection. If you have fever persisting and you really think it's urinary infection, especially if the child has difficulty in urinating or grunts in urination or has pain while urinating, go straight away for a clean catch urine. If the child is older, they will cooperate with you. It's called the midstream urine. So you clean the genital area both in boys and girls, and you hold the container as they pee. If they indicate that they're going to pee, if they're not toilet trained, it's more challenging. It takes time, but it's worth the wait, because when you send a bag sample for urine, invariably you get a contaminant, and then you are confused whether to treat it or not. Of course, the microscopy findings may guide you, but it's not going to be adequate. So my request, get away from ordering bag urine samples. Even if the parents say it's difficult, they need to spend the time. In a baby in the NICU, or if a child is hospitalized, you can do a suprapubic aspirate or a catheter sample. I hope this short message is useful, and please do share. Thank you.